Pneumonia. Pneumonia is a dangerous disease and the leading cause of hospitalization and death in young children, the elderly, and people with underlying health conditions. The number of casualties due to pneumonia is putting pressure on disease control in many countries around the world. What is pneumonia? Pneumonia is a condition in which the lung parenchyma becomes infected, swollen, including inflammation of the alveoli, small air sacs, alveolar ducts, interstitial connective tissue and terminal bronchiolitis caused by bacteria, caused by viruses and fungi. When the alveoli and airways contain a lot of mucus or pus, secretions from the upper respiratory tract cause phlegm, cough, fever, chills, and difficulty breathing. Pneumonia can appear in one area or several areas, lobar or multilobar pneumonia, which is more dangerous than inflammation of the entire lung. Pneumonia is the leading cause of death in children worldwide, accounting for 14% of all deaths in children under 5 years of age, of which 20 to 45% of pneumonia cases are caused by pneumococcus. It is estimated that each year, a child under 5 years old can get respiratory infections 5 to 8 times. According to the World Health Organization, WHO, an estimated 150 million episodes of pneumonia occur in children in developing countries every year, with about 11 million children hospitalized. According to data from UNICEF and WHO, pneumonia kills 2 million children each year, more than AIDS, malaria and measles combined. It is estimated that every day, about 4,300 children die from pneumonia worldwide, meaning that every 20 seconds, one child dies from pneumonia in the world. Causes of pneumonia. The causes of pneumonia can be classified in many different ways based on the source of infection, purpose, and causative agent. In general, the causes of pneumonia are mainly divided into the following 4 types. Community-acquired pneumonia. Bacterial pneumonia. Bacteria are the most common cause of pneumonia in children and adults. Bacterial pneumonia, if not recognized early and treated promptly, can easily lead to unpredictable consequences, even death. Common types of bacteria include Streptococcus pneumoniae, Legionella pneumophila, Haemophilus influenza, Mycoplasma pneumoniae, Chlamydia pneumoniae. According to statistics, pneumococcus, Streptococcus pneumoniae, is the most common and dangerous culprit, causing pneumonia in this group. The disease causes mortality from 10 to 20% and 50% in high-risk groups such as young children and the elderly. Pneumococcus resides in the human pharynx, is most transmitted through the air, coughing, sneezing, and spreads through contact with sick or healthy people carrying pneumococcal bacteria in their bodies. The treatment of pneumococcal pneumonia has been a painful problem for the medical industry, because pneumococcus is a highly virulent bacteria, capable of causing red blood cell rupture and invasion, causing cell death. Pneumococcus is increasing the level of antibiotic resistance. It is necessary to choose high doses of antibiotics and need to combine 2 to 3 types of antibiotics, especially if the pneumonia is severe. Up to 3 types of antibiotics may be needed. Birth, combined at the same time, and treatment time can be long with very expensive treatment costs to cure the disease. Viral pneumonia, including COVID-19, according to statistics from the World Health Organization, WHO, up to 30% of pneumonia cases are caused by viral infections, second only to bacteria. There are many types of viruses that cause illness, such as respiratory syncytial virus, RSV, seasonal flu, colds and flu, and the SARS-CoV-2 virus that causes COVID-19. Fungal pneumonia. Fungal pneumonia is a condition in which the patient inhales fungal spores, causing infection, seriously affecting the respiratory system. The disease often progresses quickly and is very complicated. If not treated promptly, it can cause dangerous complications and even death. Besides fungal spores, factors such as cigarette smoke, dust, chemicals, improper diet, exercise, etc. also create conditions for fungal pneumonia to form and develop. Easily develops and causes pneumonia. Chemical pneumonia. Chemical pneumonia is rarely occurs but is extremely dangerous because of its high mortality rate. Depending on the type of chemical exposed, the level of danger to the patient will vary. Besides lung damage, chemicals can damage many other important organs in the body such as the nervous system, circulatory system, liver, and urinary organs. Hospital-acquired pneumonia. Hospital-acquired pneumonia is the most common hospital-acquired infection. In developed countries, hospital-acquired pneumonia accounts for 15% of all hospital-acquired infections and 27% of infections in intensive care units, a very high rate. The leading bacteria causing this condition include gram-positive bacteria such as Staphylococcus aureus including MRSA, intestinal gram-negative bacilli such as Escherichia coli, Klebsiella pneumoniae, gram-negative bacteria not originating from intestinal tract such as Pseudomonas aeruginosa, bacteria residing in the pharynx of seriously ill patients in the hospital. Pneumonia due to medical care. Healthcare-associated pneumonia is considered part of hospital-acquired pneumonia because the patient received care or treatment after, have been hospitalized for more than 48 hours within 90 days of infection. Living/residing in a nursing home or long-term care center. Recent intravenous antibiotic treatment, chemotherapy, or wound care within 30 days. Hemodialysis in a hospital or dialysis unit. Aspiration pneumonia. Airborne pneumonia is a condition in which the patient inhales a large amount of foreign objects from the airways, mouth, pharynx, stomach, and then falls into the lungs on both sides. Foreign bodies can be saliva, food, chemicals, or gastric acid. If they enter the lungs, they will stimulate the inflammatory response of the lung mucosa, creating an opportunity for bacteria to invade and cause pneumonia. Symptoms of pneumonia. Symptoms of pneumonia vary from mild to severe, depending on factors such as the type of bacteria causing the pneumonia, the patient's age and overall health. Mild signs and symptoms are often similar to those of a cold or flu, but they last longer. Signs and symptoms of pneumonia may include chest pain when you breathe or cough with phlegm, tired, fever, sweats and chills. In the elderly or immunocompromised, fever may not be present, nausea, vomiting or diarrhea, shortness of breath. Pneumonia in infants and young children may not have any warning signs of pneumonia. However, children may still show signs such as vomiting, high fever, convulsions, cough. Children are irritable and tired. Children have difficulty breathing, stop feeding and refuse to eat, pale, lethargic, chest concave. Methods of diagnosing pneumonia. Pneumonia can have clear clinical symptoms, but there are also many cases of pneumonia that are asymptomatic. The doctor will base on the medical condition and prescribe laboratory tests for the patient to perform tests to diagnose and find the cause of pneumonia. Clinical examination. The doctor will ask your medical history to look for signs of cough, difficulty breathing, fever and other accompanying symptoms. At the same time, look for dangerous signs such as difficulty breathing, paleness, and lethargy. Count breathing rates to monitor how fast or slow the patient is breathing. Auscultate the lungs to find abnormal crackles, moist crackles, subclinical, blood test. Check lung infection through white blood cell count. Sputum culture looks for bacteria or fungi causing lung infections. From there, the doctor finds the best antibiotic to treat the infection. Chest X-ray. Chest X-ray helps diagnose pneumonia. On X-ray, images of parenchymal damage such as damage to the alveoli and lung interstitium will appear. CT scan. This method plays a particularly important role in the diagnosis of lung opacities. Find even the smallest or most subtle injuries that X-rays miss. Bronchoscopy. This is a procedure that helps doctors observe the respiratory tract with a flexible scope, bronchoscope, to diagnose lung diseases. Additionally, The procedure allows the doctor to take samples of lung tissue, cells, or fluid. The combined clinical and paraclinical process helps doctors differentiate pneumonia from other dangerous diseases such as foreign bodies in the airway, asthma, congenital lung disease, or other causes of respiratory failure, such as cardiovascular disease, heart failure, congenital heart disease. Methods of treating pneumonia. Methods of treating pneumonia. According to Western medicine, pneumonia needs to be detected early and treated promptly to prevent infection and stop complications. Treatment for pneumonia needs to be appropriate to each symptom and progression of the disease. In some cases, when the disease has become severe, treatment will be extremely difficult. According to medical experts, treatments for pneumonia include: treat symptoms, use medications such as fever reducer/pain reliever, paracetamol, cough medicine, expectorant, bronchodilator, to control pneumonia symptoms and reduce discomfort for the patient. Treat the cause. Depending on the causative agent and severity, different treatment methods can be applied. Bacterial pneumonia. Use antibiotics, aspirin, ibuprofen, Advil, Motrin IB, others, and acetaminophen, Tylenol. If your condition does not improve, your doctor may recommend a different antibiotic. Viral pneumonia, ineffective when using antibiotics to treat. Patients need to have a proper diet, rest, and drink plenty of water to dilute phlegm and mucus in the body. Take fever-reducing medicine when you have a fever above 38.5 degrees Celsius. Pneumonia caused by fungal infection can be completely treated by using appropriate antifungal medication. Adults and the elderly who have severe pneumonia with symptoms of severe difficulty breathing and labored breathing should be taken to the hospital for early treatment. Particularly for infants under 2 months old with symptoms of pneumonia, they must be hospitalized immediately. Children from 2 to 5 years old who do not eat or drink, have convulsions, stay asleep, are difficult to wake up, or have difficulty breathing must be immediately hospitalized for treatment. Methods of treating pneumonia. According to Oriental medicine, treat pneumonia with ingredients found in your garden. Garlic is an indispensable dish to help treat pneumonia. Garlic contains allicin, which has antibacterial properties, so adding a lot of garlic to your daily meals will help treat pneumonia effectively. However, eating too much will cause bad breath. Prepare dishes with a moderate amount of garlic so that the body can absorb allicin from garlic without side effects. How to treat pneumonia in children at home with mulberry juice. According to the book Complete Oriental Medicine, the bark and roots of the mulberry tree are effective in treating dry coughs and expectorating phlegm. People with pneumonia boil the leaves, bark and roots of the mulberry tree to get water and drink 2 to 3 times a day. The disease will quickly heal after just a short time. How to treat pneumonia with Oriental medicine in young children using perilla leaves. Perilla leaf essential oil has the effect of inhibiting Staphylococcus aureus, hemolytic streptococcus, and pneumococcus bacteria. Together with the active ingredient luteolin, it is an effective anti-allergy and expectorant. Every day, take 3 to 10 grams of perilla leaves and boil it in drinking water to help relieve chest pain and recover quickly. How to prevent pneumonia. Each person should balance their diet, use natural products and change their lifestyle to prevent pneumonia. To prevent pneumonia, people should use the following natural foods: dark green vegetables, colorful vegetables. These vegetables contain natural anti-inflammatory substances for the body, helping to reduce swelling and irritation in the lungs. You should eat a lot of broccoli, tomatoes, bell peppers, mustard greens, spinach, citrus fruits, apples, pineapples. These fruits are rich in vitamin C, a powerful antioxidant that helps strengthen the immune system and prevent infections. You should eat a lot of oranges, tangerines, grapefruit, lemons, apples, pineapples, avocado. Avocado contains a lot of vitamin E, vitamin B6 and vitamin K, which has the ability to fight bacteria that cause lung infections. Besides, the high magnesium content in avocado is very good for bronchial asthma patients, helping to increase lung capacity to receive more oxygen. You should also get vaccinated against pneumococcus and influenza, stop smoking, wash your hands regularly and follow a healthy lifestyle, including eating a balanced diet and exercising regularly. These are important measures to protect you from pneumonia-causing agents.